My point here is that expensive or not expensive is a very subjective thing. How can we double the fee? If you allow me, give me the chance, and I can try an appointment with one of your patients and see how it goes. So he said, okay, let's try. One day he called me, say, I have the patient. It's a new patient. Not sure if he wants to do the treatment with us. Maybe you can try this one. So I did my homework. We did the whole documentation, and I prepared a story. I prepared a presentation. I talked to the orthodontist. I talked to the periodontist. I, of course, relied on my own know-how of treatment planning. I talked to the main dentist, really developed a beautiful plan, but more than that, developed a beautiful story to explain why this plan was a life-changing plan. And I went to the appointment with my laptop, with my images, with my presentation, my slide presentation, my models, my mock-up, and I did what became the first and second DSD appointments that became a landmark for DSD. And I performed the process, and the patient said yes for the new fee. So, of course, I went back to the dentist and said, okay, now remember, you have to pay me double for my restorations. The patient is on board, and your new fee for this patient is double compared to what you used to charge. Long story short, after a few months, from one patient, it became 5 patients, then 10 patients, then 20 patients, and suddenly the new fee for that practice was this fee. My point here is that expensive or not expensive is a very subjective thing. It all depends on perceived value and emotional priorities. So if we are great clinicians and great technicians already, we have the right, we deserve the right to explore communication skills, storytelling, patient experience, to change people's priorities, and to make people choose dentistry, because we know that choice is the best for them, for the patient. And that's how the whole strategy of emotional dentistry started, and it became one of the main pillars of the DSD philosophy.